What are the lobes of the liver? Imagine your liver as a busy, multi-roomed organ with different sections working together to keep you healthy. The liver is divided into four main parts called lobes, each with its own shape and position inside your upper abdomen. The largest lobe is the right lobe, which takes up most of the space on the right side of your body. It is about 6 times bigger than the left lobe and has a somewhat four-sided shape. On its back and bottom surfaces, the right lobe has 3 depressions or fossae. These fossae are important because they hold key structures like the portal vein, which supplies blood to the liver, the gallbladder, which stores bile, and the inferior vena cava, the large vein that carries blood back to the heart. Although the caudate and quadrate lobes are often considered part of the right lobe because of their location, they are actually smaller and have distinct identities. The left lobe is smaller and flatter, sitting mainly in the upper left part of your abdomen. Its top surface curves against the diaphragm, the muscle that helps you breathe, while its underside shows impressions from the stomach and the omentum, a fatty apron that hangs over your stomach. The 2 lobes are separated by a thin fibrous band called the falciform ligament, which connects the liver to the front wall of your abdomen. The caudate lobe is a tiny, somewhat independent part located on the back of the liver near the large vein called the inferior vena cava. It is unique because it gets blood from both the right and left branches of the portal vein and the hepatic artery, which supplies blood to the liver. This dual blood supply makes it functionally special. The quadrate lobe is also small and sits on the underside of the liver, between the gallbladder and the falciform ligament. Although it is considered part of the right lobe anatomically, its position makes it stand out. From a functional point of view, the liver is divided into right and left parts based on how blood flows into it and how bile is drained out. This division is an imaginary line passing through the middle of the gallbladder and the inferior vena cava. Interestingly, in this system, the caudate and quadrate lobes are grouped with the left lobe because of their blood supply and drainage patterns. The liver is further divided into smaller sections called segments, with 8 segments in total. These segments are based on the liver's blood vessels and bile ducts and are very important in surgery. When doctors remove tumors or treat liver disease, they often target specific segments to preserve as much healthy tissue as possible. Knowing the lobar and segmental anatomy helps in planning treatments for liver cancer and other liver conditions. Understanding the lobes of the liver is essential because many liver diseases, including tumors, tend to develop in specific lobes or segments. This knowledge guides surgeons in removing affected parts while keeping the rest of the liver healthy. The blood supply to the caudate lobe can influence how tumors spread and how surgeries are performed. Diseases like cirrhosis can affect different lobes in different ways, impacting how well your liver functions overall. In summary, your liver is made up of 4 main lobes: the large right lobe, the smaller left lobe, and the tiny caudate and quadrate lobes. The right lobe is the biggest, and the other lobes have their own unique positions and functions. The division into lobes and segments is vital for diagnosing, treating, and surgically managing liver conditions, especially liver cancer. Always consult healthcare professionals for personalized advice and treatment options, as liver health can vary greatly from person to person.